I do enjoy the fact that there's a lot of moving parts in the ER. It's often been characterized as organized chaos. Hi, I'm Josh Pollock. I am an RN, a registered nurse. I'm a charge nurse at HCA Florida Capital Hospital. Working as a registered nurse, especially in the ER, which is the department that I work in, we receive people to the hospital who have either traumatic injuries, or they have some kind of a health-related illness. And so whenever they come in, we triage them. We find out how sick they are, which category they need to go into, what resources we'll need to be able to take care of that patient and to get them to either a point where we can discharge them to go home safely, or we can admit them to the hospital for long-term care. And so it involves starting IVs, drawing blood, giving IV medication or any other type of medication, different life-saving interventions, assist the doctors with any of the need to stabilize airways or to do any critical interventions. In nursing school, we learn the basics. We get a base knowledge to figure out the things that are going on in the body and the things that can cause that not to work the way that it's supposed to. And so we have to know a lot about the anatomy, have to know a lot about the way that the intricate parts of the body work. And so that way we can take that and use that information to try to fix the problem, try to get somebody headed in a better direction, try to get somebody towards healing and getting back to home, back to their everyday life. Once you're an RN, you have nearly unlimited options for careers and opportunities. There are traveling opportunities, there are opportunities close to home. You can be a school nurse, you can work in the hospital, you can work in an emergency setting, you can work in a long-term care setting, you can go into management, you can work in an 8 to 5 Monday through Friday role, you can work at a doctor's office or an urgent care. The options are really unlimited once you get your nursing degree, and then from there you can take your education and your career in whatever direction you like to. The role of the charge nurse is that the department that you're in, you handle the day-to-day operations, all of the things that are going on, all of the right now decisions that need to be made. You make those decisions and you move forward with a plan of action, whatever the plan of action may be, and you may have to adapt it later. But right now, somebody's got to make a decision of what we're going to do and how we're going to go forth with it. So in that crunch time, you make a decision. The typical education pathway, you can either do it in stages or you can do it all at one time. So the stages that you can do is you can start as even a CNA, a certified nursing assistant, get some experience there, go back to LPN school, which I believe is typically a year to a year and a half. Or you can go straight through an associate's degree RN program, which is a 2-year program. Or some people like to jump right into it and get everything done up front, and you can go to a university and you can do a 4-year program. And that way you come out with the same RN license, but you have a bachelor's degree to go with it. I think that one thing that makes me good at being a nurse is the fact that I've lived a lot of life. I've got a lot of experience. I enjoy being around people. I enjoy getting to know people. I enjoy taking their worst day and trying to make it a little bit better. And so the human aspect is a big part of it. The education that I've gotten is certainly helpful. The base knowledge is really important, and it's something that you need to have to be able to start your career. But once you get into it, really having a desire to take care of people and having a desire to try to make something better than it was, I think that's what makes me a good RN. One of the recommendations that I would have for someone who's interested in being a healthcare professional is do volunteer work to begin with. Volunteer at your local hospital, do some job shadowing, and that'll help out a lot with getting you exposure to taking care of people and being around people. The other thing that I would suggest is go ahead and as soon as you get done with high school, start working on getting your education. Do it now, do it while you're young, because the older you get and the more involved that your life gets and the more responsibilities that you have, the harder it is to go back and get that education. And so if you can do it now, you can do yourself a lot of favors for down the road and go ahead and set up your life for later now. The thing that I think about when I get home that makes me love my job and want to come back the next day is that I see improvement. I see where throughout the day, something that I've been able to do or the team that I have has been able to do is I've seen it cause something to be better than it was when we started. We don't always get the instant gratification. However, if we can see that small part where we made somebody's life better, then that's what makes it worth coming back the next day. Just remember that you can do what you want to do. I spent many years not knowing if I'd be able to go back to nursing school. And so the one thing that I will say is even if it doesn't happen exactly when you want it, stick with it, keep working hard, and you can make it happen.